Hi everyone, I am Dr. Vimee Bindra, robotic and laparoscopic endometriosis surgeon. Today I will talk about postmenopausal bleeding. Postmenopausal bleeding is very important because after menopause by definition is complete cessation of periods for complete 1 year. So after menopause, if you have bleeding, we always raise a suspicion of a endometrial cancer. Not always it is cancer, but then please do not ignore it and you should go to your gynecologist and get yourself evaluated. Now, sometimes patients come to us with postmenopausal bleeding and they say, Doctor, anyways, I'm menopausal. Why don't you do my hysterectomy directly? So, for postmenopausal bleeding, the first step is that we do a hysteroscopy and a biopsy. Biopsy is mandatory to decide the further course of action. Now, this request, when it comes from the patients where they say, why two procedures? One, you will do biopsy and then you will take us for hysterectomy. Why not direct? There are reasons behind it. Suppose your biopsy comes as normal, it will be a simple hysterectomy with bilateral salpingo-oophorectomy. But if your biopsy comes as abnormal or suspicious cancer changes or frank cancer changes, your surgery will be different from a normal hysterectomy. It will be hysterectomy with bilateral salpingo-oophorectomy with pelvic lymph node dissection as well. So there will be complete staging also done with the diagnosis of endometrial cancer if it is there in the biopsy report. So do not try to bypass that procedure and do not request your doctor to do a direct hysterectomy. Now, suppose somebody has done a direct hysterectomy with bilateral salpingo-oophorectomy, the uterus is sent for pathology, and after 1 week, you get the report of cancer. So, your lymph node sampling was not done. And sometimes patients are also offered that, okay, we will not do anything, we will directly go in, do the bilateral salpingo-oophorectomy with uterus removal with lymph node dissection, and the report comes as benign. So, it's vice versa. Both the situations can happen. You are doing an unnecessary procedure for a benign disease. So there can be a benign polyp for which the postmenopausal bleeding happened. For this, lymph node dissection is not needed. Lymph node dissection has its own hazards. There can be seroma, there can be excessive abdominal collections. Patients may have longer recovery time, morbidity with lymph node dissection. So we should not do lymph node dissection for benign pathologies and we should do lymph node dissection for malignant pathologies. So very important that we do a biopsy, and if it is benign, you can also avoid hysterectomy. So please, if you have postmenopausal bleeding, expert gynecologist opinion is needed and go step by step. First, let them do a hysteroscopy biopsy and then let them schedule your surgery properly, be it a normal hysterectomy or be it a oncosurgery. Thank you.